Hello, my name is Dr. Abdul Rahman Salem. I'm a doctor of physical therapy from Brooklyn, New York. Today I want to show you how I'm going to do segmental mobilization, auxiliary anterior-posterior for the lumbar spine. Look here, guys. Okay, how am I going to do that? I can do in two ways. First, okay, this is my hand here. I'm going to specify the level I want to mobilize. Okay, let us say I'm going to mobilize like L1. So I'm gonna L1 and L2. So I'm gonna stabilize L1 and above. Okay, my hand here will stabilize L1 and above. And look here, both knees are here. And if I push here, I'm posteriorly translating. And if I pull here, I'm anterior translating. Posteriorly, anteriorly, posterior, anterior, posterior, anterior. And I can change the level. Now I'm going to mobilize now L2, L3. Stabilize above, stabilize with my hand, and mobilize the lower one. Anterior, posterior, anterior, posterior, anterior, posterior. Okay, this is for translation. Okay, the coronal plane. This movement is mobilizing in the coronal plane translation anterior, posterior. Okay, I'm going to show you how to mobilize like flexion extension. This is very good for any case where lumbar spine, whatever, let's say assume lumbar spine, where the segmental mobility is lost, or with any nervous supply. Like say if the dermatome of that level is affected, if the muscle of that level is affected, if the viscera that takes the autonomic nervous supply from that level is affected, this is going to help. The consequences for all the four, we spoke before about the four variables we have. Our body, like spinal segment, each spinal segment give nerve supply to a dermatome, give a motor supply to a muscle, give a motor supply to a viscera. Now we have four elements. Viscera from the autonomic, skin from a dermatome, muscle from the motor, and we have the vertebra itself. Any issue with the four, all four get affected. If you fix the whole four, it gets better, of course. If you fix one, you're going to all fix it. And all this situation happened, the vertebra loses its segmental mobility. So how I'm going to mobilize again? Look at me. I'm going to stabilize the level here. I'm going to keep both legs. See, the legs are here, in front of just above from my ASIS. I'm going to stabilize here, and I'm going to move this way. See, and I push back. Look at the lumbar spine now. Here. I stabilize above, mobilize below. Stabilize above, mobilize below. Okay, now flexion, extension. Flexion, extension. I can move down. Flexion, extension. You're going to feel it really well. When you stabilize here, it's really stabilized. The level below is moving more. You can do combined movement. Flexion, extension. I can do a little bit translation. See this? I'm adding translation. I take flexion. Camera is here. Okay. Flexion and extension. I can add a little bit translation as well. I can do combined movement. Flexion, extension, flexion, extension, flexion, extension. I can do side bending as well. If I do like this will take to side bending, a little bit side bending, okay? You take the legs and move up. This side bending, it can help side bending, okay? When I hug here, this side bending. Some side bending to the left side. And you can do the other side as well. This side bending. And I can do combined movement. Flexion, extension while I'm side bending. And I can do the rotation as well. How I'm going to do the rotation? This is the rotation. This is the rotation. Okay, rotation, rotation. It's good.